Well, around 80 medics are getting ready to head to Sierra Leone at the moment. They will be there training local health workers, Sierra Leone health workers, on how to treat Ebola patients safely. Joining me is Major Scott Hamspey and Captain Harriet Sloth. Scott, you are overseeing the squadron. Just tell us exactly what they'll be doing once they get onto the ground.
When we get onto the ground in Sierra Leone, what we'll be doing is we'll be training the local Sierra Leone healthcare workers so that they can get the infection control skills up to standard, where they can operate and practice safely within the new 700-bed facility that's being built.
And what does that actually mean practically then? How do you train people to treat Ebola patients safely?
So that they're doing things hygienically, that they're cleaning up the equipment and the kit and the work areas, that they're wearing the protective clothing correctly, and that should prevent the infection and prevent it from being transmitted to them.
And Harriet, you've overseen the training of everyone here today. What do you think are the biggest challenges you face when you head out there?
I think the biggest challenges are making sure that our medics are able to deliver that training that they've received out on the ground and have the correct equipment and resources to be able to do so. I'm fully confident they will be able to do a good job when they get out there.
And you've got a huge task ahead of you, haven't you? Because the World Health Organization says we should expect up to 10,000 cases every week by December. I mean, how do you think you'll cope with that level of problems?
This is kind of incidents our medics train for, so they're all well prepared, they're all fully trained, and we've just updated that training with mission-specific tasking so that they understand exactly what they're going out there to do, and we'll validate them that they are able to do that. So I'm fully confident they'll be able to do that.
And how do you feel yourself about heading out? Because obviously health workers are at particular risk of contracting this virus. Hundreds have in West Africa. Are you worried about that?
No, I'm very confident in the training I've received. I'm confident in our abilities as a team. I think we'll be able to work well. I think we're able to make a real difference out there and do what we're here to do essentially as medics.
And what difference do you hope you can make to this outbreak?
I think we can certainly make a difference and train healthcare workers and hopefully stop the infection from spreading anymore and delivering that training that we've received to a high level and high standard.
Okay, thank you very much. Well, also on this flight will be the International Development Secretary, Justine Greening. She's heading over to see how the £125 million pledge of money from Britain will be spent. And she also says that key to ensuring that Ebola doesn't come to the UK, that people in the UK aren't infected, is ensuring that this is contained within West Africa. And that is why she says this pledge and these medics are so important to helping bring this outbreak under control.